Right, we're at 2 minutes past, so we'll get started. Good afternoon, everybody. Thank you for joining us today. This webinar will be recorded and will be shared publicly afterwards. Sarah, next slide, please. So good afternoon, everybody. It is my pleasure to be hosting the second Humber and North Yorkshire LEAP placement webinar series this year. During our webinar today, Joanna and Helen will provide you with the context and background to the student-led health roadshows. There were 10 health roadshows in primary care practices in Northumberland, delivering health checks and health promotion advice to patients. We'll be highlighting why this is important to our wider system at Humber and North Yorkshire Integrated Care Partnership, the ICP. We hope to offer an overview of the creation, the outcomes, and how this is developing nationally too, and of course leave you with some contact details to support any future initiatives you might consider and you think we might be able to support you with. There'll be some time at the end of our webinar to take any questions you're posting in chat, and if we run out of time, we'll be collating all these questions and make sure they are answered and posted to you in our post-webinar communication, which will be around 2 weeks from today. Next slide, please. So my name is George Zerner. I'm one of the LEAP project managers working towards the GRAIL Workforce Strategic Priority, hosted within the People Directorate of Humber and North Yorkshire Integrated Care Partnership. I'm delighted to introduce you today to my colleagues, Joanna Vintis and Helen Stainsby, who are practice placement facilitators in North East and North Cumbria. Contact details are included later on in the slide deck should you wish to get in touch, including hyperlinks to our Twitter and future NHS platform. Please do tweet us with the hashtag #NursesOnTour, and the Twitter accounts are in the bottom corner of the slide, and share any information about anything that stands out for you today. We'd love to hear from you. Next slide, please, Sarah. Before I provide you with a brief overview of the LEAP programme, I thought it would be helpful to clarify the role of integrated care systems and why this particular project is of strategic importance to us. Apologies to those who are attending who are already familiar with integrated care systems, also referred to as the ICSs. Our health and care systems are partnerships of organisations that come together to plan and deliver joined up health and care services and work together to improve the lives of people who live and work in their area. Humber and North Yorkshire Health and Care Partnership are one of 42 statutory health and care systems now established across England. We are one of 4 ICSs within the North East and Yorkshire region, and we have 6 places within our geographical footprint. The Humber and North Yorkshire Health and Care Partnership have recently refreshed their integrated health and care strategy, and this slide outlines our ongoing ambition to improve the lives of our residents and to increase their life expectancy. It is underpinned by the Health Foundation building blocks of good health. Our vision is for all people to start well, live well, age well, and die well. We have a set of intentions to achieve this vision, which focus on creating right conditions within our ICS that will change, empower, and enable our residents to think person, enabling people to live healthy, independent, and safe lives for as long as possible, understanding what matters to them rather than what is the matter with them. Think family, supporting families to enable everyone to be safe, grow and learn, and that every child has the best start in life. And think community, by being all-inclusive through a community approach that ensures the next generation are healthier than the last and have the opportunity to thrive. Next slide, please, Sarah. So LEAP stands for Learning Environments, Assessments and Placements. It is a time-limited NHS England programme established within Humber and North Yorkshire since 2020. Health Education England's main aim originally was to increase practice-based placement learning opportunities for pre-registration learners in order to meet our national workforce ambitions. Despite this, our primary stakeholder group agreed that at the start of the programme that an increase in practice-based learning opportunities would more likely be an incidental output of our projects. This is because placement expansion is more complex than just opening up new learning spaces. This allowed us to adapt our strategy and our ambition, and has always been to fund and develop interventions for any learner, and to also make sure that our existing workforce were included within the definition of a learner. We have a LEAP strategy and delivery plan. We are supporting the delivery of 3 strategic priorities and 5 objectives outlined on this slide. Our priorities are all based on the call to action within the NHS People Plan. to grow our workforce, train our people, and work together differently. The LEAP programme is effectively an enabler, providing funding for proof of concept pilots that can be sustained and reproduced at scale beyond the life of LEAP. You can find out more about the programme by following the links to our web pages and our Future NHS platform. Next slide, please. So for now, however, I'm delighted to hand over to Joanna and Helen to share information about their Nurses on Tour student-led health roadshows. Next slide, please, Sarah.
Hi, everyone. It's really lovely to be able to talk about Nurses on Tour. Helen and I get slightly giddy every time we're allowed to talk about Nurses on Tour because it was the most amazing experience we had. So to introduce myself, I am Joanna Vintis. I've been a practice nurse now for 13 years. 2 or 3 years ago, I lose track now. COVID has confused everybody's timelines. I took a split role and I shared my time between a clinical role and work with Northumberland CCG, which was a thing at the time. And last year I moved, so now I'm a full-time PPF and lead nurse for the Federation in Newcastle, which is NGPS. And I was very fortunate enough early in my career to meet the fabulous Helen Stainsby, who I will allow to introduce herself.
Thank you very much. So my name's Helen Stainsby. I am a practice placement facilitator and nurse by background for the Enabling Effective Learning Environments team. We work across the North East and North Cumbria in a similar way to the Yorkshire LEAP team, looking at placement capacity and placement expansion, placement quality, new ideas, new models. And as Joanna said, we met in our respective roles, recognised a kindred spirit that we wanted to do something big and fun and just have a little bit of a shake-up of placements, try something new, and so we did. Next slide, please.
So,
Joanna.
In context, so I was a practice nurse working 3 days a week, and my practice was Netherfield House Surgery, and we took on student nurses probably about 4 or 5 years ago, and I realised very quickly that I loved it. I really enjoyed having student nurses in my clinic, and that's what inspired me to take my role within Northumberland CCG, because it was all about increasing student capacity. And when I met with Helen, it was in a pub. We always debate how much we should tell people that, but we were in a pub and we did have a very nice meal. There was no alcohol involved. And I can really vividly remember saying to Helen, I just wish I could pick up the students that I've got and place them in practices and show them how amazing the student nurses are, because we knew that at Netherfield and we just felt like there was always a barrier of practices saying, oh, we haven't got space, time, capacity, all the things we already know. And Helen sort of looked across the table and was like, well, why don't we? And we sort of went, that's a good point. So we decided that we would take our Nurses on Tour, and it was a working title, Nurses on Tour, and it never really changed, did it, Helen?
Well, it's exactly what it was. Yeah, exactly what it was. We literally packed up your car with everything, found some wonderful willing student volunteers, which we'll tell you a little bit more about that later on in the presentation, and literally went to 10 GP practices across Northumberland to offer health checks and health promotion to their patients. So we wanted to not only expose student nurse from all fields of practice to primary care and to promote primary care as a potential first destination career. We were hearing so often that, oh, I can't possibly go into primary care. I have to do 2 years in a hospital first, which actually isn't the case in many, many areas. So we wanted to show students that it could be done and what primary care was all about. But also we wanted to show the practices how amazing student nurses can be. It's not just, oh, what am I going to do with this student? It's look what the students can do for you. So we had the two aims of the project from the very beginning. I think, Joanna, in Netherfield, you had a diabetic health roadshow day just in your practice, where you had that sort of model of inviting patients in for a drop-in session with the students who delivered a bit of a health check, giving some information, health promotion, and that was really the model we decided to use for our tour, wasn't it?
It was, and it was using students in a way that they benefited, and they learned how they could create a program that benefited patients, it benefited the practice, and it was something that as a team they really enjoyed. And it was very much that inspiration of actually, when we have enough students together, they can create something spectacular. And what Helen and I want to do with this project is just allow the students to showcase that and to go to practices, and for them to be able to stand up and say, this is what we're capable of as student nurses, because some of our practice nurses have been in post for 25 years. They qualified in a different manner. The training was very different, and they don't see student nurses in the way that I see student nurses, because I work with them all the time. So this project really was to highlight what student nurses can bring to primary care, because often when you think about student placements on a ward, they are an integral part of that ward team. They are there working and learning. And in general practice, there was a strange view that students just had to sit behind you and listen. And that was my experience as a student nurse quite a few moons ago, that I sat with a practice nurse and she told me I was going to be bored because I wasn't going to learn anything, because I did sit and look at the back of her head for half a day. So what we wanted to do was create an environment where students felt really welcomed and encouraged, and that they were going to achieve a lot through being with us. And there are a lot of selfies. Everybody buckle in for a lot of selfies. Could we have the next slide, please, Sarah? Not a selfie. I did well. So in terms of what the students did, we modelled our health check roadshow on the NHS health check. So within Northumberland, the contract is held by each individual practice for the NHS health check. So because we were going to a GP practice, we came under that contract to deliver an NHS health check. So we covered everything that we would look for in an NHS health check. So all their patient details, their family history, the basic observations. We did an audit C and a GPAC. We did their smoking status, and we talked about dementia signs and symptoms. If anybody's non-clinical, which, sorry, I apologise, sometimes I do say those things and they don't make sense to anybody. They're just the screening tools that are part of the health check, but it'll make sense later on. If I think, Helen, am I right? That slides on. Yeah,
absolutely.
And that developed over a couple of roadshows, didn't it, Helen?
It did. It did. The main part of this was one of the barriers we come across a lot with practices of, well, we don't have a room. We don't have a room for the student. We don't have a computer for the student. We had no rooms. We were in car parks. We were sort of in conservatory areas around the back of practices. We were in the health promotion rooms. We were pretty much anywhere. We just had gazebos when it rained. We made it a carnival atmosphere. We showed that we do not need a computer to do a lot of these things. We developed a protocol, which will come up next. We got the approval from practices because it was their patients we were seeing. The protocol we would follow would be one that they were happy with, and they would take action on any abnormal results we found.
If we can have the next slide, please, Sarah. So this is the pro forma that the student nurses developed. So we did go on paper, we went old school with this, and that was to enable as many practices to take up the offer. As Helen said, we weren't relying on IT, we had it on paper. What you can see there is it's color coded as well, so that any normal results were no action, they went in one box, and that was for the practice to input that data later on, but there was no urgent need to get it done. The amber ones were the abnormal but okay results. And they were the ones that we needed the practices to follow up on. So as Helen said, practices agreed to this beforehand. And we said, if we give you a patient in an amber category, then you will have to arrange follow-up within the practice within the next week. Didn't have to be reviewed by then, they just had to have a plan. The red ones were the urgent same day, and that was agreed by all the practices that we would be seen by their on-call GP or whoever was their on-call clinician at the time. And actually, that was one of the things that the students got a lot out of, wasn't it, Helen? Because we really pushed the students to assess their patients themselves. Helen and I were there as qualified nurses, but the students really had to think about it. And if there was a handover that happened, we made sure that the students were the ones that did it. So they went into the GP practice, spoke to the reception team, found out what the process was in that practice, and then followed it up with a GP. A lot of the times the student actually stayed with the patients and followed them through their journey. We had some patients initiated on treatment that day. We had others that were seen as an emergency up at ambulatory care. So there was lots going on. I've just seen a question there about smart cards. So no, none of these students had logins at the time. This was all on paper, going from what the patients were telling us. So the patients that were invited in for the health check were the ones that the practice identified for us. So no pre-existing conditions and no medications. So in theory, a very safe environment for the student nurses to flex their nursing muscles, as it were. And it was really well received, I think. Would you agree, Helen?
I would. I mean, safety-wise, if the students had any queries or concerns, they were straight over to talk to us. All red patients were run by us. So we would come, we would check the patient was safe, double check any observations if we felt it was necessary, and then agree with the student to follow the red protocol. So we were the qualified nurses there on the day, but the students led it. They were absolutely fantastic. We rotated the role of nominally nurse in charge, so we all the completed forms would go through the nurse in charge, which would be one of the students who would have a look through, make sure they'd been triaged correctly, and ensure the patient followed the appropriate pathway. So it gave the students chance to not only develop their skills, their actual practical skills with doing the health check, but also a bit of communication with each other, teaching each other, educating each other, handing over to each other, and yeah, just that coordination, that leadership role. So we really felt that the students, as well as giving a lot, they got a lot from it as well.
It was a lovely moment when one of the students came up to us and sort of said, "Oh, I've got this patient here. Their blood pressure's quite high. It was in the red." And sort of, well, what would you do next? And when they gave us the answer to that, because as a team they'd already discussed it and come up with the solution, Helen and I were sort of like very proud mother hens, just going, yeah, that is right, that's what you're going to do. And it was like, we had patients as well who were worried about dizziness when they stood up, so the students knew to do a sitting and standing blood pressure. So very much Helen and I got to just sit back and enjoy watching these students do something that really made a difference. And I think that's one of the things the students got out of it, was actually identifying patients and spotting patients with AF, so atrial fibrillation, and irregular pulses, is genuinely life-saving. And getting patients started on treatment that day just was fabulous. So shall we go to the next slide, Sarah, please?
Yeah, so we used a coaching approach with this. It wasn't us teaching the students, it was them leading it with our supervision. We would have a safety huddle, if you want to call it that, at the beginning of every roadshow. Once all the equipment is set up, we made sure that all the new students who were coming knew how to use all the equipment, were familiar with how to take a manual pulse. We worked out who could take a manual blood pressure and who couldn't, and therefore we would step in if there's any double checking needed. Checking that everybody knew what the plan of the day was, everyone was familiar with the protocols, just to ensure that we were ready to go. If we had students who hadn't been to an event, we tried to pair them up with a student who had already been, just so they could work together for the first few patients, a buddy system, before they were happy to fly on their own with their own station. So it really did give those more experienced third-year students, or even second-year students, let's face it, to take that leadership role. They train, they support their peers under our guidance. And students from different fields were paired together. We tried to do that so they could share their expertise. And in fact, there was one really good example where we had a mental health student nurse, it wasn't on the protocol, but through the conversations with the patient, identified that she was concerned that a patient really did have low mood. And we wasn't on the protocol, but we flagged it to the practice anyway. And then at the end of the nurses on tour, that day, she was able to tell her colleagues from different fields what her warning signs were, what she picked up, why it was concerning to her, and what she felt would needed to happen. So they all learned from each other, which really, again, just made us very proud and very happy. And I'll be totally honest, as a secondary care based nurse, I learned a lot from them as well. See, Joanna's laughing. I'm used to dealing with, well, that's blood pressure, that's fine, the patient's conscious, everything's okay, critical care background here. Whereas Joanna had to tap us on the shoulder and go, no, these are healthy people. Just you need to learn from the students. And I did. And I
But
did.
that's one of the things that I really love about the nurse on tour model. It's something that because I've hosted students myself for a long period of time, I was used to juggling multiple students around. And I think that would be one of the challenges of a program like this, is making sure that the nurse supervision is somebody that is comfortable delegating to students and really letting them fly, because Helen and I often would meet these students within sort of 30, 40 minutes. They were running a clinic and they were on their own. But because we had that buddy system and other student nurses were looking after each other. So there was 2 student nurses, Erin and Kaylee, who were my students who were allocated to Netherfield House Surgery. They were 2 children's nurses, and they would often take the lead, wouldn't they, Helen, for most of the students. And in a morning, if there was clinical skills that we needed building up, Erin and Kaylee would usually take those students to one side and support them with that. So it was a really lovely model, and actually seeing all the 4 fields of nursing, we had first, second and third year students all working together. You got to see their development and growth, and it was just amazing. Helen and I are going to really bore you by the amount of times we go. We really loved it and it was amazing. So just run with it now, I think.
It was. It wasn't just the student nurses as well. On a couple of the roadshows, we had other professionals with us. So we had, is it Cancer Champion? Is that what her role was?
So I had a cancer champion, yeah.
Absolutely. So she came along and spoke about different screening options for patients who were waiting to see the student nurses, and actually gave a talk to the student nurses during the lunchtime quieter period about the national screening programs and signs and symptoms, etc., which the student really benefit from. And in one of the somewhat larger roadshows that we will come to, they had their social prescribing team set up stalls there. So while we had the queues and the carnival atmosphere with all the bunting, they were able to talk to patients as well. Patients could approach them, they could explain their role. And again, the students could interact with the social prescribers to understand their role as well. So we absolutely see the possibilities here for other professions to join this. Yes, it's started off as nurses on tour, but I absolutely don't see why not. We can't invite lots of other people to come and be part of this as well.
We did have nursing associates as well. We had a few of them join us, and we did have some trainee healthcares who joined in as well while we were at that practice. The practice released them to come out and join in. So it really was a fantastic event to get workforce development on the radar. So can we have the next slide, please, Sarah?
One thing to mention as well, the one part we didn't do on every of the health check that we didn't do on every roadshow was venipuncture. We felt that was just a little bit difficult to achieve in a car park. Some of our practices made some staff available so that when the students had finished delivering their part of the health check to the patients, we offered the patient the chance if they wanted to go in and get their bloods done at the same time. Some practices set up special clinics over the following weeks so that they have extra capacity for venipuncture to invite the patients back. I think on one of them we did start to do. We had a little room that we could offer some venipuncture in with our third year students who had been doing it in practice anyway and was supervised in that room by Joanna while I stayed out with the others. So yes, the venipuncture was the one part that we couldn't guarantee delivering, just didn't have the resources and it wasn't the appropriate environment in a car park.
We could do most things in a car park, but venipuncture, we
felt that
drew
was
the
a step
line
too
out.
far.
Yeah.
We felt that was a step too far.
The one big event that we did, which Helen and I will allude to, we'll tell you more later, we did run out of blood bottles at that one. So that was why we stopped there, which was quite fun. But as we've mentioned, Helen and I were always on hand. We think that it's really important with an event like this that you have a minimum of 2 clinical supervisors there, because if there was an event happening and you were taken away, that would leave the rest vulnerable. So it's really important that there are at least 2 registered clinicians, in my opinion, there to supervise it. We worked really hard to get the protocol as robust as we could, and it was something that was agreed in advance with all the practices. So we were always very clear as to what was our responsibility and what we were handing over to the practice and what they were going to do with it. And I think because that was really robust, wasn't it? We felt very safe.
Yeah, and absolutely. And we agreed that any emergency situations will be dealt with according to the practice's own emergency policy. So yeah, everyone was working and singing from the same song sheet, basically, I think.
And it was just seeing that sort of the supervision aspect of it was, for me, the greatest thing of my nursing career, like without doubt. Watching a team of, at one point, I think we had 12, 13 students working, seeing them so busy and all so confident and so engaged. Like, just was fabulous. So before I get too giddy, could we have the next slide, Sarah? Can you tell we're getting slightly more excited as we go on? And this is one of the things that we really loved, the fact that we managed to get all 4 fields represented at this tour. When we did meet our learning disability nurse, we may have taken a lot of selfies and giggled quite a bit. The first learning disability nurse that we had there actually really took the lead in promoting this with her cohort and wanted to make sure that more learning disability students came and were represented at the event. She has also won Learning Disability Student Nurse of the Year. So we're working with some excellent students.
And claiming credit for a lot of that,
yes,
I think. Yeah.
I think her victory in that award was mostly based to me and Helen. I'm sure the other 3 years of her training were fine, but the work she did with Nurses on Tour was the pinnacle. And seeing the other practices be able to see that primary care has a place for all these 4 fields of nursing and a really valid place, and also educating the students as well that primary care landscape is changing and we're hoping to be welcoming more registrants in. And I know from Helen's perspective with your team, that placement hours was really quite important, wasn't it?
Yeah, it was. We wanted to show that it could be part of placement expansion. I mean, as it comes, in order to do this first sort of run of 10 roadshows, we timed this deliberately so that students were already out on placement. So those students who are out in placement in primary care, we stole them, and we did open this up and offer it out to other student nurses who may have been in secondary care, other community teams. We wanted to make it possible that they could volunteer to spend a day with us. They could do one roadshow, they could do all of the roadshows. We would take pretty much anybody. I think with the fewest we had on a roadshow was 5 or 6, and the most I think was about 13 or 14. It says 40 students in total in the middle there, but actually doing a more accurate tally, it was 48 different students altogether. We don't mean we had them all at the same time, but we managed to access 48 different students from both of the universities that had student placements into Northumberland. So that we're very proud of. We can see this as a model that could be work as a placement on its own. It could be day after day after day, take the same students around. However, it's a long day and it's really quite tiring. So I think if you were, people could work it the way they want to work it, but I think if you had a solid week of this, you would have you would have very, very tired students by the end of it. So we felt this worked. We had 1 or 2 a week, I think, over the summer roadshows. Don't think we had more than 2 in a week. But we took the students from wherever they were on placement just to show that it could be done. So the placement hours, they'd agreed them with their host placement, but they still counted as placement hours. We could sign them off. But we absolutely think this model could be adapted and used to add additional capacity to the system.
And it was something that we agreed with the university beforehand as well. Helen and I are very familiar with the PAD documents that our student nurses work with. We went through and highlighted the proficiencies and the skills that we felt students would be able to achieve while doing the tour. So it was showing to the university that it was a really good educational environment for them to be in as well. And the feedback we got from the students was, yeah, they really did achieve a lot.
Yeah.
So could we have the next slide, please, Sarah? I'm going to keep going higher every time I say that, sorry. And this is just to give you an overview of what we did. So as you can see, Railway Medical in Blythe in Northumberland. Helen and I didn't quite know what to do with ourselves that day. We joked well, not joked, it was a serious ambition. We always said we wanted to crack 100 patients in one day. And bearing in mind, Northumberland is a very rural county. Some of our practices only have 1,200 patients. So when you see them at sort of 30, 40, that's actually phenomenal for some practices. But Railway is our biggest practice in Northumberland with 30,000 patients, and we saw over 200 patients in one day with a team of incredibly exhausted students by the end of the day.
Happily exhausted, I will just put in there for student health and well-being. We did look after them. They were very tired, but they were very happy as well. And we gave them chocolate and fruit.
Yeah, and the practice was amazing. The practice literally went to the local supermarket, filled a trolley with drinks and ice lollies and everything you could imagine, and just were pumping it into the student team because they could recognise how fantastic the students were doing. And the students loved it. It was the most fabulous environment to be in, and that was where we had social prescribers. The practice team were coming out to Q-Bust because there was a lot going on. But equally, you know, some of the smaller practices had amazing turnouts. And
Yeah.
what you can see on that, so the red sections, as you would expect, were those urgent ones. So you can see that in terms of the workload, there wasn't a lot of urgent on the day things that needed to be reviewing. But as a nurse and as a primary care nurse, the ambers, those yellow ones, really got me excited because they were things that identified those patients as the ones I want to get a hold of. They are the ones that we can make super positive impacts on their health and well-being. So identifying those and being able to highlight those to the practice and say, these are the people we want you to target and follow up on was phenomenal. And from a practice point of view, all those green ones are £25 rolling in for every single patient as part of the NHS Health Check programme. So it really helped practices engage with us because there was a financial incentive for doing an NHS health check. Helen and I were savvy in the fact that we did pick that for that particular reason, because we realised that we needed to have something that enticed practices in a different way. So by us going, we are going to bring the students, we're bringing the supervision, we're bringing all the equipment. All we need you to do is advertise it and process the results. It really made a massive difference in how our practices engaged with us. And it made our life a little bit easier from that perspective, didn't it, Helen?
Yeah, absolutely. We did, by the end, we were asking practices to help us with some of the consumables, like the gauze for after and some of the sharps, for taking BMs and photocopying more protocol sheets because we had more patients than we expected. So we were starting to ask practices to give a little back by that point because we couldn't provide it all. But we turned up with the main part of the equipment. Thankfully, Joanna worked in primary care, had a very, very good source of blood sugar monitoring machines and blood pressure machines, so we could come fairly well equipped. And I think even your neighbour's gazebo made an appearance, didn't it, when we've decided we needed an extra one.
Yeah, oh, there was a rainy day coming and I had 3 gazebos. I don't know why my husband at some point in our marriage decided that we needed 3 gazebos, but I'm very, very pleased he did. And then I did have to borrow another one from a friend. And it did. And I think as well, one of the things that Helen and I sometimes forget to talk about is that we really didn't have a budget for this. And this was really Helen and I just going, we want to do something different. So I managed to scrounge, I think it was about £100 from Northumberland CCG when I said, look, I really want to do this. I just need some consumable stuff. So I ordered it through my practices accounts and gave my practice the funding that I'd got from the CCG. So Helen and I were able to do this on about £100.
Yeah, it was a shoestring.
And that included a big portion of the budget was bunting. I did spend an awful lot on bunting, but it was needed. I think you can't really do a roadshow like this without bunting.
It was an event. It was the carnival atmosphere, and I'm afraid you knocked my idea of the mariachi band on the head, didn't you? Couldn't really hear the patients.
We were thinking about it for a while, but it was a case of this very much was grab and go. And we would turn up to practices and say, have you got any tables that we can borrow? Have you got any chairs? Because we didn't have capacity to transport that equipment round. So we were at one point, a practice bought out a bookcase. I do recall.
Yeah, do you want a bookcase? But of course we said yes. I don't know what we were going to do with it, but they, yeah, we'll have a
Patient
bookcase.
information leaflets went on it.
Yeah.
We really did make the best of the situation we had. And as a nurse, that is something that I think nurses are phenomenal at. Give us a challenge and we will rise to it. And then the students did as well. And, you know, Helen and I now, if anybody wants a gazebo put up, I think Helen and I can put one up in about 3 seconds.
Oh, yeah, we've got it slick now.
Yeah, we're pretty good. So that sort of the outcomes from that are phenomenal. And I think depending on who Helen and I are talked to, we do gear up this information differently. So if I'm talking to my practices and trying to get them excited about it, I do very much talk about the income that the students generated in terms of smoking status, audit Cs, blood pressures, the NHS health check payment. If I'm talking about this impact on students, I'm talking to them about those reds that we've identified and those ambers and the lives potentially that we save with that. So it's that information looks very dull, but actually weirdly, again, me and Helen can get excited about it.
Absolutely. Yeah, I mean, there was one patient actually who came out as a red. She was extremely high blood pressure. We went into the practice, student handed over, and the message back from the on-call GP was, sit her down, don't let her leave. I've been trying to get her into the practice for 2 years. She hasn't engaged with us. I want to see her, and I'll see her now. I'm on my way. Do not let her leave. And that was a patient who just came along because it was something different. It was an event. She wanted to see what was what. And therefore, we found potentially very, very serious condition. And she started her treatment immediately. So all of that was because it was something different. It attracts people into a practice in a way that just maybe the routine text wasn't going to.
It was fab. Can we have the next slide, please, Sarah?
Yes, student evaluation. So we did do it properly. We did ask them what they thought. I've highlighted one in yellow because that really did answer one of our primary aims at the beginning. I've always had an interest in primary care, but this event has confirmed it as an area of interest in the future. That was what we wanted. We wanted to show students that primary care was an option, or indeed, if it wasn't an option, that's fine. But giving students an understanding of what primary care is going to help with communication between primary and secondary care. But that comment was absolutely key for us. We're very proud, and we didn't even make her write that.
It was lovely. And for me, just having the chance for these students, and far more students than we could have accommodated in one GP practice, chance to speak to a practice nurse and to speak with the reception staff and the other nurses and the healthcares and the nursing associates, and just ask the question about, how did you get this job? Like, what was your career like beforehand? Who did what? That was invaluable, and we really enjoyed it. So the patient feedback's great, but we shan't read it all out. We'll send it out to you. Could I have the next slide, please? And this is kind of what our practice has said. And again, just that one at the bottom, we were just so impressed with how the students worked. And for me, that's great. And the fact that, we're raising the profile of what student nurses can do and getting practices excited about welcoming students in, not seeing them as a burden and something that's going to drain their nurses' resources, their clinic resources. We're actually adding to it. So we had some fantastic practices, and practices hopefully that are going to continue engaging with students in the future.
Yeah, that top comment as well, it has encouraged us to consider hosting students. That was one of our other aims. We wanted placement expansion on the back of this. So we showed them how brilliant the students were, and they then went away going, want more of this.
That's fab. Next slide, please, Sarah. And I do get slightly emotional when I talk about Amy, because Amy is very near and dear to my heart. So Amy joined me at Netherfield House as a third-year student nurse. And from the very beginning, she was like, I'm going to be a practice nurse, by the way, just so you're aware. And it was really Amy that helped shape Nurses Onto Her a little bit, because we realised that we needed to push her and get her to do something a bit more challenging, because she was already geared up and ready. So we had her at the beginning of her third year. She came back as part of Nurses on Tour and helped lead some of the days as the nurse in charge. And Amy was fortunate enough to get a place on a Career Start programme as a newly qualified nurse. And she's been in post now for almost a year. And for me, it's emotional because she was one of my students and she's now one of my colleagues in primary care. And she was just amazing. And I think the more opportunities we give for students to experience primary care and to fall in love with it, we're going to get more nurses like her joining the workforce. And really, I said very early on, didn't I, Helen, that I'm fairly sure she'll be my boss one day.
Oh, yeah, without a doubt. She was my boss on the day.
In all fairness, you maybe needed it at time.
I did on that first one. I did learn because I'm a good student myself.
Very good.
But yeah, this for me isn't about nicking nurses from secondary care. This is about getting the right people in the right job at the right time. I don't understand why student nurses have to do 2 years in a hospital if they only want to work in primary care. Why not? Otherwise, you've got a hospital that's invested 2 years into an individual and then losing them because they're running to primary care. Let's get it right from the beginning if we can. And with Amy, we got it right from the beginning.
We did. And I think it's, again, just, you've got to sort of widen that out and just get as many students as possible to experience it, because you never know which student is going to take that on and get to see that primary care is where they want to be. So we need to get more and more students through. And Nurses on Tour, I believe, is the way to do that. And it's been adopted in lots of different places. So Could we have a look at the next slide, please, Sarah? There hasn't actually been as many selfies as I remember.
Oh, they're all there. Yeah, they
Are they
are there.
coming?
Yeah. Oh, that's a blank one. Oh,
no,
it's there.
this is
There you
'cause it's
go.
all
There's your
of it.
selfies.
So this is a combination. So the students got tortured by myself because I do love a selfie. If anybody follows me on Twitter, selfies are my favorite thing in the world. So every time we always got the students to take a picture, and I just think that visual of all these student nurses coming in and being part of primary care, it may have just been for a day. Some of them came to, I think one of the students came to about 8 sessions. She came to a lot, and just being able to be part of the team and welcome it, I just think that is the most gorgeous visual of students in primary care. And that second from the top on the left there, that is us at Railway Medical. That was all the students that survived till the very end. A lot of students did have to go early for that one. So at the end, there was the hardcore of us that had seen 213 patients that day. And it's lovely to see the different environments we're in. So there's car parks, there's fields, we're inside a waiting room, health education room. It was just fabulous. And I did spend quite a lot of time making hats, and nobody else wore them. So if anybody does Nurses on Tour in the future, I insist you all wear hats.
We did have badges. We had badges.
We did have lovely badges, yes. And we really want that hashtag Nurses on Tour to continue, because we think it's really important that as a pilot that it continues to grow and develop. And if anybody is thinking about it, please do use our hashtag, so that Helen and I can stalk you online.
Absolutely.
Because we love seeing it.
Could we have the next slide, please, Sarah? That's it. Yeah, so this is us on tour. Exactly. So the Yellow Star is where it all began in Northumberland. We are rolling it out in lots. These are just stars in the areas that we know about. We know that it's rolling out in other areas. We've spoken about this. We've written an article. We've attended multiple talks down in the southwest. You can see we did a talk in the southwest, and Gloucestershire are running it, and Bristol are running it too. So yes, we want to get more stars on that map. We want to know where it's going. Just an example of how we do it slightly differently. We had the Melissa bus, which is in the northeast of North Cumbria. It's Health Education England as was bus that is mobile education. So we had the bus, we parked it on Darlington Town High Street and did a Know Your Numbers campaign with student nurses. So we're taking blood pressures, talking to patients about their health. And that was slightly different to coordinate, because that one town had one PCN and everyone was happy that their patients could be seen on that bus. Whereas thinking about it differently, some places we went to, we maybe had 2 different GP surgeries working at the same building. We were told, no, you see our patients, you don't see their patients, you're here for our patients. So there are sometimes politics to dance around, but as long as you get that right at the outset, then yeah, I think the sky's the limit. Go on a bus, go on a train, wherever you need to go, just get student nurses out there.
Yeah, Hayley Ingleson's doing a project down in Leeds. Excuse my geography. It is Leeds, isn't it? Yeah, I'm rubbish at geography.
The stars on there.
Yeah.
I think.
In the middle. And she's doing a project that's kind of blended this. So students are being allocated to a PCN. They do 2 days of NHS health checks through their placement, and the rest of it they're working in a GP practice doing other things. They're working with social prescribers, so lots of things. And also, so in Newcastle and the Federation I'm in now, we are doing a joint project with student nurses and pharmacy students, and we have brought a lovely shiny bus. And we're going to be going out on tour in that, using the same sort of health check model. So there's lots of different ways that you can incorporate this. It doesn't have to be a huge project, but it can be. Have they recruited? Sorry, if anybody didn't see in the group chat, somebody has said they've recruited. I did go down to their celebration event and met some of their first cohort of students, and they were phenomenal and absolutely loved their placement, and that they were able to have some independence. I think that's what Nurses on Tour is about. It's about encouraging students to think differently about the impact that they're having, and seeing the projects. And Sarah in Gloucester, hers is fabulous. I love the setup she's got, and seeing it develop on Twitter and places like that is just phenomenal. It's a beautiful thing.
And we are still excited. This was last summer we did this. So it was kind of, yeah, we're heading this pretty much this time last year, and we are still buzzing. Yes, and we started it, Sarah, thank you. Yes, It's still so exciting, it's still new and it's still fresh to us. So we will never, ever tire of talking about this. So could we have the next slide, please? So really, this is to throw it open for you guys. We've got sort of 15 minutes left of the webinar. So it's really to have a think about how could this be adapted for use in your area? What do you think other professions could be involved? How do you think you want to do it? So could we have the next slide, please, Sarah? I think this is ending on us. Oh, yeah, there we go. That's the end.
Ladies, that was brilliant. Left me really infused. Yeah, it was really cool listening to you. I think somebody mentioned in the chat, really free-flowing, podcast-esque, really engaging. And I know if I need any gazebos or bunting putting up, I'll give you a shout.
We
That's
are the ladies.
thing.
Yeah.
There you go. Yeah, just say a big thank you to Joanne and Helen for sharing your innovative journey and experience with Nurses on Tour and highlighting the positive impact of such a project, including learners, HCIs and providers. Really happy that you presented it to the Humber and North Yorkshire. If this is something anybody has further interest in providing as a project, please do get in touch with the LEAP team. There's some contact details on this slide, which is good timing to mention our LEAP placement coordinator, Claire Pemberton. Unfortunately, Claire couldn't attend today, but is welcoming any conversations, connections to support placement provision and support any activities and projects you wish to consider. The main element of Claire's role is to support placement expansion in private, independent, voluntary in the care sector. And is looking to reach out to charities, primary care homes in local councils, that kind of thing. We realise there's lots of health and social care students going out in secondary care, but we want to utilise the voluntary and charity sectors to offer more placement opportunities. So Claire's newly appointed and she's currently working with the local HEIs to identify any gaps. So I know there's gaps in mental health and learning disability placements. So Claire is focusing on that as well at the moment. Next slide, please, Sarah.
Sorry, just to say as well that Joanna and I developed what we call a Nurses on Tour guide. So that's a resource that just basically tells you step by step how we did it. It doesn't mean it's how you should do it, but it's how we did it. So if anybody is interested, please get in touch on our emails from the slide and we'll happily share what we've got with you.
Maggie, the recording will be able to be viewed and it'll be posted out in the post communications from the webinar. So please scan the QR code to complete a feedback form. We'd really appreciate any feedback on the webinar as we look to improve our work. And I know the LEAP team really enjoy getting feedback. I'll leave this up as we work through the Q&A. I know some have been answered as we've gone through the webinar, but I'll turn on the microphones and cameras now for anybody else that has any other questions. Bear with me.
One other thing actually that I didn't mention was the way that in my new role in Newcastle, how we've used this information about Nurses on Tour to change the conversations about our student nurses. So when I joined the Federation, we had 2 learning environments. Because of the way we've been able to talk about student nurses, I'm up to 20. And I've got a team of 9 student nurses out on placement at the moment who are rotating across those 20 learning environments, hosting clinics, doing health checks. And the way that we can adapt this is endless. So any ideas you've got, throw them at us and Helen and I can throw in our ideas as well.
If anybody's got any questions, feel free to put your hand up, turn your mic on. I know one question that had previously come up, Joanna and Helen, was about the sustainability of the model and how long can it continue. So yeah, just be interested to hear your thoughts on that one.
I think it can continue however long you want to. Patients need annual health checks. So this is the potential. This could be a rolling year-on-year program. I think you can change it to suit your needs at the time. I think, you know, for me, that's a benefit, the flexibility of the model. That's what makes it sustainable. You can turn it into what you want. I don't know what you think, Joanna.
I would agree. I think in terms of being a practice nurse working in practice, obviously the eligibility for health checks changes as you grow older. So as soon as you tip over, is it 40? I think it is. New people are eligible for the health check all the time. You can also target it to certain demographics that are not taken up the offer of the health check. So you could go to local schools and catch parents and grandparents at drop-offs. There's lots of different ways that this model can be adapted. And I just, as Helen said, the need for blood pressure checks and cholesterol checks will never disappear. We will never get through the entire population, although Helen and I might try. If anyone wants to open up a gazebo somewhere, me and Helen will arrive. But I think also there's always going to be new challenges in primary care, and it's using a model like this to adapt to it and identify things that we can do differently. So we did a diabetes prevention one initially at Netherfield that got really positive reviews. So we recalled everybody who was at risk of developing diabetes and put on a health promotion day for that. So there's lots of different things that we can do to really make an impact on the quality of our patients' lives, which is the whole aim of it, isn't it?
Actually, on that note, I think you had a mental health student nurse who developed a resource about the emotional impact of being diagnosed with a long-term condition like diabetes. So that's something that the practice didn't have before the student arrived, and definitely did by the end. So again, it just shows what value and what impact students bring.
Yeah, that's great. Sounds absolutely brilliant. I haven't seen any more questions come through. Any last orders? If anybody's got anything. If not, we will start to round things up and just say thank you for everybody's attendance. Again, thank you to Joanna and Helen for presenting. Hopefully you found it thought-provoking, and we hope to hear from you or see you soon in any of our upcoming webinars. Thank you very much.
Thanks, everyone.
Thank you.
Thank you.
Ladies, sorry, just a quick question. So it's Kasia Doran. I am nurse practitioner based in Grantham. If we were trying to utilize our nurses in the same way, because I was just typing email away and I missed that bit. Is it better? Do we contact you and can you come with your show to us and use our nurses, or do we need to set up something similar to use our nurses, our student nurses?
Yeah, I would use your student nurses because that's your future workforce right there.
Yeah.
If they're in your environment, you know, they want to work for you in your areas, I would absolutely use your students. More than happily pay a visit because I do like getting out and about. But you know, if you want to know more information, or if you, as I say, we can happily send you the Nurses on Tour guide to sort of, it breaks it down a little bit about the nuts and bolts of what we did. And then you can look at it and develop it and work out what you want out of this type of model.
Yeah, brilliant. Because I think, yeah, that would just help. So apart from being a nurse practitioner, I don't know if Helen is still watching or if she left the room already, but I am also helping with the Lincolnshire Training Hub, and we set up the new role to sort of try and expand the primary care placements at the moment. And definitely out of the surgeries that were allocated to me that I've contacted, and there was a lot of them, apart from not responding in a timely manner, then there was only a couple that were actually, oh, okay. Usually they prefer to have medical registrars because that's the workforce. They can see the patients, they can be very independent. But definitely selling the monetary value, like the payments for the NHS checks, BP, smoking status, that's all very good. I know in my surgery we've got a problem with vaccination. So again, if we could maybe set up something similar, but then, like you've mentioned, at schools, nurseries, to try and get the patient, the parents to then put something on the records with regards to vaccination, we can probably, well, there will be called for it somewhere, I'm sure of that. So maybe that would be the selling point. So yes, definitely, I would like to find out a bit more. I did email Sarah, so yeah.
That's great.
And
so
just to add, sorry, Joanna, just to say, Kasia, I think we've talked about the guide. Are you happy, Joanna and Helen, for us to put that on our future NHS site?
Yeah, it's on ours. So yeah, absolutely.
So if you join us in that space, you just have to register. If you're used to future NHS, you just join the space, and everything we have about LEAP is on there. You're very welcome to download any of it. There's lots of other useful information resources. And I think you're on the right track in terms of the adaptability of the pilot and the model. I think anything is possible, and it is about that gap identification, isn't it? What is going to work for you and your general practice, and indeed the wider primary care place and neighbourhood? You know, you'll find all of a sudden you're
Yeah.
dotting the I's and crossing the T's for multiple stakeholders just through this intervention. As I said in the chat, we're talking to pharmacy about doing something similar in our area with the University of Hull. And George, you're connected to the Lincoln area, aren't you? It may be from a previous life. It might be that you can pick up a conversation as well. So I will email you back with some more contact details for us.
Brilliant. Thank you very much. Oh, yes. And I've got the link for the future NHS now. Cool. Thank you. Thank you.
Good luck.
Good
Thank
luck.
you. Bye-bye.
Bye.
Bye.